I'm Jamila Miller. Is that me? No. So again, I'm Jamila Miller. I work for Maternity Care Coalition. As described, I am the program manager for Montco Mamas. I've been with Maternity Care Coalition. My anniversary is actually this Thursday, so it'll be 8 years. I was an early Head Start advocate and then started doing the backbone work for Montco Mamas and became the program manager last year. So do I have host privileges to share my screen?
Yes.
Okay. So if you could just give me 1 second. All right, can everyone see my presentation? Yeah, I'm gonna assume that's a yes because I can't see the group anymore. All right, so I'm presenting to you Montco Mamas. So Montco Mamas is a part of Maternity Care Coalition. So Maternity Care Coalition started about 40 plus years ago for similar reasons as the work we do with Montco Mamas. So they noticed a high infant mortality rate among Black babies in the city of Philadelphia, and they wanted to address that and create action steps moving forward to reducing that high infant mortality rate. Sister Teresita, who you see in this picture here, along with other members, put together a small group known as Mommobile. And what they did was they went throughout the neighborhoods of Philadelphia, educating women on prenatal care, the importance of nutrition, the importance of being connected to health professionals, including their OBGYN doctors, making sure they're going to their appointments, also looking into mental health support, being provided during the prenatal care, labor and delivery, as well as that postpartum period, because postpartum or baby blues, as well as psychosis, was a big concern with new parents. So that was the starting point. And then Maternity Care Coalition, well, Mommobile grew into Maternity Care Coalition, which now has services in areas such as Philadelphia, Montgomery County. We're also in Bucks, we're in Delco, and we're continuing to branch out to other areas to continue to support the healthy birth and outcomes of babies, as well as healthy maternal support. So what you see here is just kind of like the background of where Montco Mamas came from. So there's a steering committee under the Maternal Early Childhood Consortium and Maternity Care Coalition. We worked in partnership with Maternity Early Childhood Consortium, also known as MECC, to create this steering committee. And the steering committee focused on the different impact areas that you see listed here. And where Montco Mamas falls in is this area where it says PPOR planning. What they did was the county looked into the infant mortality and morbidity rate for Montgomery County. And what they found was a high infant mortality and morbidity rate among Black babies in comparison to white babies. What they did with that work was they put together recommendations, which Montco Mamas we use as our action steps. They put together 12 recommendations, also an initiative, naming it Montco Mamas, and proceeded forward with addressing the high infant mortality rate that they saw in the county. And so that's where we come in. So one of the things we identified was a common agenda. So a common agenda is defined as a shared vision that all participants have that comes to a common understanding. So the common understanding that we have in terms of what's the big problem right now in Montgomery County is that Black babies in Montgomery County are 2.6 times as likely to die as babies of white women, with the highest cause of death being due to low birth weight. So that's our common agenda, our common problem, and we all come together as Montco Mamas to address the problem. So what you see here is our priorities, also known as our goals. So again, we had 12 recommendations that came to us from the PPOR report. And I'm sorry, I didn't mention that when they found the outcome, the high infant mortality rate, they put it together in what was called the perinatal period of risk report, which is available for you to read at your leisure on the Montgomery County's website. It's a very good read. It shows you all the statistics of what they found in the county. It also highlights some of the experiences, the challenges, and successes of what we call our lived experience experts. So they are the people who have birthed in Montgomery County and live in Montgomery County. But again, that's called the Perinatal Period of Risk Study, PPOR report, and it's available to anyone to access on the Montgomery County website. So the 12 recommendations, what we did was in 2021, we brought together a group of community members from different sectors that support Montgomery County families. And with that group, we prioritized top 3 out of the 12 recommendations and turned those 3 recommendations into our first set of goals. So those goals are in no particular order, but those 3 goals are to increase the use of maternal and child health professionals, such as doulas, home visitors, and lactation professionals, provide targeted education about reproductive health, behavioral health, and overall health and parenting that will give agency to Black women, birthing people, and families. And then our third goal is to increase providers' understanding of Black women and Black birthing experiences. And we are working on these goals, pieces of these goals, some simultaneously and then others directly. So this is our vision and our mission as it relates to Montco Mamas in Montgomery County. So our vision is to see a Montgomery County where each Black child born brings hope for our future, and all Black women, birthing people, and families receive the sources, the opportunities, and support needed to have healthy pregnancies and healthy birth outcomes. Our mission is to eliminate inequities that surround race and infant mortality and to support healthy birth outcomes for Black women, birthing people, and families that live in Montgomery County. So what you have here is our principles. So essentially our principles is how we move towards achieving our goals. And we do that in 5 ways. So the first, we acknowledge that communities are made up of multitude of voices, and each voice is very instrumental in creating systems change. And we do that in a role called our lived experience experts. So these community members are present in each step of our development of Montco Mama. So when we prioritized those 12 recommendations, we had lived experiences and we compensated them for their time. We had lived experiences experts a part of that development. Their voice was important because they represented the community. So, we had 6 members who were part of our stakeholder group to help us prioritize what was important to them, what was missing for them when they had their birthing experience. Number 2 is eliminating racial inequities in healthcare and other institutions. We understand that it requires getting to the root cause of systemic issues. So no surface cleaning, no surface problem solving. We understand that we have to get to the root cause of what's going on and address that to be able to see real systemic change. We also identify that anti-racist cultural humility and trauma-informed practices are necessary when it comes to creating and sustaining equitable solutions. 4, Black women, birthing people, and families deserve access to safe and healthy care throughout the pregnancy continuum. And that pregnancy continuum is from the time of conception all the way to postpartum. We understand that it's very important that they have the access that they need to everything to support them throughout that journey. And 5th, resources must be physically, financially, and culturally accessible to all families to really see systemic change. So what you see here is our journey, how we started and where we are today. Again, we started out with the PPOR study conducted by Montgomery County Department of Public Health in partnership with Maternity Care Coalition. That work was done from 2018 up to February 2020 when the report was released. Between February 2020 and July 2021, we worked on our implementation plan. So that was that portion where we brought together community members to create a stakeholders group, and we prioritized those 12 recommendations to become our top 3 goals moving forward. Between July 2021 to July 2022, we focused on long-term planning for goal 1. And just a reminder, goal 1 was our increased use of allied health professionals. And one of those health professionals we identified are doulas. So we focused on partnering with our doula and breastfeeding program that we have at Maternity Care Coalition to create a training cohort that would take place in Montgomery County. We started out with having a few members from the community join the current training that was happening in Philadelphia, and then kind of familiarizing ourselves with the process of conducting the training to be able to replicate it in Montgomery County. So between July 2022 and the fall of 2022, which was around October, prior to that, we had applied for the ARPA grant, which was a part of the pandemic relief funds, and we were one of the recipients. And what we were able to do with that moving forward was to recruit my team, which I was very grateful for, because prior to that, I was doing a lot of this backbone work as an individual in partnership with a few other organizations that we work with. But it was really great to be able to start the recruitment of having a team. Then in January 2023, what we did was we took our stakeholder group that was convening every 6 months and, focusing on prioritizing our goals and putting together milestones and action steps to each goal. We brought them together to introduce to them the Montco Mama structure moving forward, as well as giving them an opportunity to be. Does someone have a question?
Tonight, the kids.
So in January 2023, we brought our stakeholders together to talk about our Montco Mama structure moving forward, but also invite members to join our task force to help us create what that structure would look like moving forward. So it was kind of a way to phase out how we had been meeting on that every 6-month period into our structure moving forward of having a governing body, action teams underneath, and then focusing on different areas that we wanted to tackle as they support our goals. So in March of 2023, with the recommendations of who should be a part of that group, we invited folks from Montgomery County community to be a part of that task force to help us create that Montco Mama structure. And some of the things we focused on was our common agenda. So what I mentioned earlier about having that shared idea of what our common problem is, and having coming up with a solution that addresses the common problem. Also putting together our steering committee. So our steering committee became our governing body. And then also looking at our Montco Mama's governance. So looking at how we would meet, how often, what would be the goal of the steering committee, how would we vote, how would we bring up, any concerns or issues, how would we address them, and then also formulating our action teams that would carry out the work of our goals. And so our steering committee started to meet in April of 2023. We have our last meeting this month. And in that meeting, we'll also discuss how often we would want to meet moving forward. But what the group has been focusing on is kind of just, revamping or refreshing our principles, making sure that our goals still align with what our anticipated outcomes are. Also taking into account who we should be inviting to those action teams as we see them, play out. And on our next is a continued timeline. So this is kind of what's been happening from about October of last year up until December of last year as well. So two of the big things that have taken place was one, again, the steering committee has continued to develop the two action teams, but also we had our first Montgomery County based doula and lactation community health worker training. We started recruitment in September of last year, and we did that in two ways. So we had ongoing virtual info sessions that took place on Fridays, and it was just an opportunity for anyone in the community who was interested in becoming a doula to be able to get more information about what a doula is, what reproductive justice is, and how the doula training relates to reproductive justice. We also had one in-person session at our MCC Norristown site, and that was to give folks an opportunity to kind of, get an experience of what the commute would be like if they joined our training. Also get an opportunity to see the space and just see each other in person, because the pandemic took its toll of us being in the house, being on virtual platforms, and we wanted an opportunity to folks to transition into that new normal of being able to do things virtually but still have that in-person connection and energy in the space, and just to be able to spend time together. So after during each virtual session as well as the in-person one, we distributed the application. It was just an online link for everyone to access, and through the application process, we filtered who would be the best candidates for our training cohort. I'm really excited to share that we actually had about 35 applications, but we had limited our class to 28. And it's typically 15 to 20, but we were really excited to launch our first training in Montgomery County. So we extended the space to add a few more people. So 28 was our total that we were like, okay, we gotta we gotta have a cutoff point. So our training started in October of last year, and it was a really great time to start in that month because October is also Pregnancy and Infant Loss Awareness Month, which ties to the purpose of why Montco Mamas exist. So, we picked that month not knowing, and now that we do know, that's going to be our starting point each year, is that we always start our fall session in October moving forward. Graduation day was December 16th, so we had our first group actually just graduated, and I'm happy to say that with the support of my team, we had 28 people in the class and we had 24 people graduate, which to date for Maternity Care Coalition's doula and lactation community health worker training is actually the largest graduating class. So I'm really proud of my team, for accomplishing that. The structure of the training was hybrid. So we met for 3 sessions a week. The training itself is 27 sessions in total, with the 27th session being graduation. But we met 3 sessions a week. 2 of them were in person at our Norristown site, and then one of them was virtual. And then, we prefaced that if there was any issues with weather, that we would immediately transition to virtual for any session as needed. And so their onboarding day, which essentially is their opportunity to get more information about what it means to be a doula, independent contractor, and in partnership with Maternity Care Coalition. That was what they learned about on onboarding day. We also did their clearances. They were able to see their contract and just really get themselves familiar with what it means to be in partnership with us and start that journey of supporting families. And that took place January 6th, so not too long ago. Currently, this group is, at different points of that clearance process, because for some it comes back right away, for others it takes a little bit longer, but we still have 24 who are very, very excited to get started. Some have actually been able to get started because their clearances came back sooner, but we anticipate all 24 will be started by February. So what you see here is the type of model that Montco Mamas was developed by. So we use what's called the collective impact model. And the reason why we use this model is because it's innovative in structure, meaning it's not set in stone um, how we approach the work moving forward. It's always adapting to what the need is. So even what you've seen today in terms of our principles, our goals, our vision, and our mission, it continues to be revamped because we always want to make sure that our goals support what the community needs are. And whenever a change needs to happen, we discuss it, we talk about it, we come to a consensus, and we make that change. It's also an intentional way of working together. So it's not just bringing people to a space and saying, hey, let's work on this, and then whatever happens, happens. We bring people to the table that either one, affect the expectant families in Montgomery County, support families in Montgomery County, or are doing similar work so that we're all doing this work and moving forward together. And it also helps to support solving complex problems. For example, we know in terms of the experience of expectant families, it's not just their experience when they get to the labor and delivery room, but rather it's all those people that they come in contact with during their pregnancy. So when they go to their appointments, it's the person at the front desk, it's the nurses, it's the doctors, when they go to the WIC office to get additional support, the nutritionist that they speak to, the receptionist that's there. We also identify like for families who need additional support, like food stamps or any other like cash assistance. Those interactions, they matter as well. So we're intentional about who we have involved because we want to make sure that everyone who has some type of influence or impact on our families understands what the problem is and are a part of the solution. So our collective group is us, Maternity Care Coalition, and the representation for that is myself and my team. We also have members of the Montgomery County Office of Public Health. We utilize Strategy Arts and PHMC, who is Public Health Management Company. We utilize the two of them to help us with collecting data, reading research, really looking into models that have taken place before, seeing what works, learning from what didn't work to, and areas of improvement. And then, as I mentioned earlier, our biggest voice in our group is our lived experience experts. So these are the people who have experienced the challenges and the successes that have been identified in the report. These are also the members of this program who voices replicate the community. So it's important that we have them be in our group. They have the highest vote, they have the largest voice. We again make sure that when we say we are doing this for the community and we are doing this because the community needs it, that it's actually what the community needs. And we do that, we kind of do that checks and balance through making sure our lived experience experts are always involved in any choices, any creations that we come up with, and any action steps moving forward. So here's where your opportunity to join us comes in. So this is our call to action. So one of our ways is pretty much just sharing with the community that our doula and lactation matching program is up and running. It's been running for this is year 2. So, and what that consists of is that doula support is available for families throughout pregnancy, labor and delivery, and the postpartum period. And we also have lactation support that's available to talk about infant feeding, so different options, and also supporting those who are doing breastfeeding and or nursing. And in case you don't know, a doula is a non-medical support person who is available to families throughout pregnancy, labor, delivery, and postpartum. And these services are free to Montgomery County residents. So if you know of anyone or you yourself are expecting and you are interested in receiving these services, you'll see my contact information on the last slide. And I can get you referred so that you can have services or you can share services with any families, any expectant families that you know of. But again, these services are completely free to families. There's no requirement other than the family living in Montgomery County. Another opportunity is through joining our doula and lactation community health worker training. This training is offered to community members as well. It's a 27 session training. It's very engaging, hands-on. We use a hybrid model. So, some of our sessions are in person, others are virtual, but we lean more towards in person because we want the experience of those going through the training to replicate how they would support families, which is in person. We also have a distribution of applications similar to how we did with our first session. The applications will be provided during each info session. We also provide childcare and dinner because we do identify that some of the community members that join our training, they have, small children who aren't in childcare yet, or when we have classes during evening hours, we know that all kids are out of school. So we provide childcare for free as a way to support those who really want to join our training. Some upcoming opportunities are that we'll have a spring training in Delco in February. So currently recruitment is happening for that. I'm sorry, the training starts in March. Recruitment is happening in February for the Delco training. That's Delaware County. And then for Montgomery County's spring training, recruitment is happening in May. And then we'll also have recruitment for our next fall session to happen in August for it to start in October. Another opportunity for a call of action is our Black Maternal Health Week. So we are in partnership with Oshun. Oshun hosts Black Maternal Health Week in the Philadelphia area. We are partnering with them by being involved in some of their events during that week in Philadelphia, as well as in Montgomery County. In Montgomery County, we'll have our community baby shower that we'll be hosting on April 17th. And then we will also be joining Oshun for Advocacy Day on April 15th. That date hasn't been confirmed, but that was the last date I had when I put this PowerPoint together. But I can also share a confirmed date and more information if anyone is interested in joining us for either one of those events, or if you're interested in joining any of the other events that's happening throughout that week. So that is my presentation. This is my information to get in contact with me. I'll share my email address in the chat. I can also follow up with AME to provide my information as well. I do have some flyers in terms of the doula support and lactation support. I also have flyers for the upcoming doula lactation community health worker training if you're interested in that. And I'll open the floor up for questions.
I have a question.
Yes.
Could you tell us, are you looking for support for the baby shower? Do you need donations
Yes.
of things or money?
Yes. So I'll be putting together a steering committee in February to start planning out the community baby shower. And yes, we need everything you mentioned. So we are looking for donations, and donations include, if you've ever been to a baby shower, gifts are exchanged, diapers, wipes. And the way we do it is we have a raffle. So each mom, each expectant parent that comes in, they're given a raffle ticket for just coming to the event, and then they're given additional raffle tickets for each outreach table that they go to. So we invite community partners and programs to have an outreach table at our baby shower so that members of the community know what resources are available to them. And then we encourage engagement through offering them additional raffle tickets for each table that they go to. And then at the end of the event, we pull out the raffle tickets and, parents win various things. So we have some really big ticket items, such as car seats and cribs, but then we're also able to distribute to every mom at least a pack of diapers and wipes. And even last year, we were donated a generous amount of baby bags. So that was really nice to be able to just pack those with different donations and give them out. And we had a turnout of about, I want to say it was 40 45 families, and all of them were able to go home with at least something. And then we also look for monetary donations that helps to support getting food, drinks provided for everyone, and then also put towards any high-end items that we're not able to get through direct donations.
So if we want to make a donation, what do we do?
Yeah, so you can actually, I put my email address in the chat, and then I will provide you with our donation form.
Okay.
And we also have donations, funds development team that also helps us with that process.
Okay. Thank you very much.
You're welcome. Thank you. And also we look for community members to be a part of the steering committee as well. So I often recruit from the other programs that we have at Maternity Care Coalition that service Montgomery County. But if you are someone who is a part of the Montgomery County community, you can also join and be a volunteer that day. So we like support with, helping with food, with the games, with, signing in families, just, monitoring the event itself, set up and clean up, decorations. So if you're interested in that as well, we're open to volunteers. Any other questions? So our funding, I see a question in the chat about how are we funded. So we are funded through the ARPA grant. So that was the grant that came out of the pandemic, and as well as the Office of Public Health, Montgomery County's Office of Public Health.
So if we are interested in the training, the best way to do that is email you.
Yes. So you can contact me if you are interested in the Delco training. The dates for that have already been planned, and that starts in March. For the Montgomery County Spring, we're looking to start in June, but we haven't selected dates yet. And then we're definitely starting in October for the fall of next year. So our fiscal year goes July 1 to June 30th. So the one in October will be the first of our next fiscal year. But if you're interested in any of them, just contact me and I'll provide you with the dates and information.
Cool. Thank you.
You're welcome. And also a call of action that I didn't put on my list is that I'm always open to having conversations. So if you have an event or a monthly meeting, or if you know someone that I should be in contact with, or you know someone who you're like, hey, this person needs to know what's going on, I am an open person to having a chat, having a meeting, or presenting the information that I shared today. Just again, feel free to reach out to me and then we can schedule time.
I have a question. My question is, have you been able to partner with any of the, I'm sure there's many, I live in Lancaster County, but I'm sure there are many physicians and practices that do maternity care in your area. So how have you been able to partner with them so they know that you're out there and they can suggest your services to any pregnant clients that come in?
That's a good question. So currently what we're doing is our steering committee is comprised of physicians. So we have some OBGYNs, we have a few pediatricians, we have those who are in the practice, but also one of our action teams, one of their goals will be to work around connecting hospitals, because that is something we don't have. So we have connections with specific doctors, but we don't have connections and relationships with every hospital that that expectant families are going to. So if you know of someone, or if you have a hospital connection and would like to share, please put it in the chat. I am open to taking that. But that would be our next focus point, is really building relationships with each hospital in Montgomery County where expectant families are going. To make sure we have that, and that they understand what the common goal is, the common agenda is, and making sure that they're in support of it, or at least having in place some type of standard of practice that supports what we're working towards. So if you know of anyone, please feel free to share.
Thank you.
Mm-hmm. So I didn't exactly time my presentation. I see I finished a little bit early, but I'm happy to stay on until time, or if there are any additional questions. I see Sandra or Sandra.
Yes, Sandra. I want to say thank you for an excellent presentation. And I'm just kind of curious. I see that you are in Montgomery County. I am in New York. I'm just wondering, do you have any programs or have any expectations to expand your program to other states? And if so, when are you going to do it, and what is the process?
So that is that's a good question. I am a future thinker, so in my mind, I would love for us to be, as far as the reach or the need it exists. Currently, we're trying to cover as much of Pennsylvania as possible, or Pennsylvania in whole. Our Delaware County group, they do kind of cover that Chester County, Philadelphia, as well as a few of the areas of Delaware State. But that's as far as we are into other states. We do have, people who are employed with us that live in, other states. So like close areas like New Jersey, who, try to make connections that way. But we're currently mostly in Pennsylvania. But my hope is, as an organization, that we do branch out and collaborate with other states.
Thank you.
You're welcome.
I had another question.
Mm-hmm.
How are you related to the greater Philadelphia area? And are they already kind of set with services with doula care and all the, are they in better shape as far as being connected to hospitals, doctors, and having a up and running program?
Mm-hmm. Yeah. So Maternity Care Coalition, our basis is in Philadelphia. So we cover all of Philadelphia in terms of program and support. And so our programs vary based on needs. So for example, we have home visiting programs that support families from pregnancy up to a certain age postpartum for the child. We also have programs such as our Early Head Start program that goes from pregnancy up until the child is 3 years old. And that's to help bridge the gap between when the child is born and Head Start. Because as you know, Head Start was created as a way to identify that learning opportunities and experiences happen prior to kindergarten. And so Early Head Start helps to bridge that gap between learning experience that happen from Head Start. And Head Start is that age 3 to 5. So Early Head Start goes from pregnancy to age 3, and then transition their families onto Head Start. But we're all around Philadelphia, and then have branched out now to Montgomery County, Bucks County, as well as Delco. So we have a stronger presence and a stronger pool of resources and connections to hospitals and OBGYN offices as well as WIC and other resource areas for families in Philadelphia. And now we're trying to replicate that same presence and strength in Montgomery County and other counties that we serve. I feel like there was another part to your question. Did I cover
No,
everything?
I think that covered it. That covered it. That was great. I wasn't
And
sure
again,
whether you,
all of our services are free to families of the area. So, you know, the services for families who live in Philadelphia are free. Same services are free to families in Montgomery County. It's just that we have way more services currently in Philadelphia because my Maternity Care Coalition has been in Philadelphia the longest, but we're trying to replicate those same accessibility to resources in the other counties that we serve.
are you able to pay the doulas that are?
Yes, I'm glad you asked that question because you reminded me that I didn't even share that. So a part of taking our training is it's kind of twofold. So with the funding that we are given, we're not only able to provide these doula and lactation support services to families for free, but we're also able to compensate our doulas. So when our doulas go through our training, or when doulas who have not trained with us go through our onboarding process and join our network, we compensate them for their time and support to families. So we provide a rate for visits that they conduct, and then also we provide a rate for attending a birth, and we support in-person births. There was a time where there was compensation for virtual births because of the pandemic, but we've now have transitioned out of using virtual support for attending a birth because we realized that the strongest impact on families is when doulas are able to be right there in the room supporting that family through labor and delivery. Another thing that we're currently doing is what's called the legacy period. So the state board doula program, they have an application that's going out right now called the legacy period. And what they're doing is they're allowing doulas who have taken training at any time period to apply for state certification. And Maternity Care Coalition, what we're doing is we're helping to support these doulas become state certified by compensating and supporting the application process. We're just asking them to turn in all the components. So their certificate of training, if they've taken any CPR training, if they've taken HIPAA training as required as a part of the application, any of those who don't have the HIPAA or first aid training, we're helping to support them by scheduling training so that they're able to take it and apply for the state certification. We currently have 26 doulas who are going through that state certification process. And our reason for doing that is because, you know, on the policy level, we know conversations, you know, are happening about reimbursing doulas through insurance. And so we wanted to prepare ourselves for that day by inviting those who are currently in our network to become state certified, and then also as a component of our trainings moving forward. So taking our training, you are automatically enrolled in the process of moving towards state certification.
Thank you.
You're welcome. Let me just double check if there were any more questions in the chat. Okay, I don't see any. So if there aren't any more questions, again, I thank you all for inviting me to this space. I thank you all for your time, for your questions. Again, my email address is in the chat. Please feel free to connect with me after today's event. Really open to having conversations with any and everyone who is interested in what we're doing, what's going on, and ways to get involved. Also, I know someone was interested in taking the training. Please feel free to contact me so that I can provide you with additional information about upcoming opportunities. If you have families who are interested in receiving our dual and lactation services, I have a flyer for that as well. I'm happy to share. And again, I thank you for your time.
Thank you.
You're welcome.